Estela Chamu's depression began when she left her hometown in Mexico at the age of 17. A family friend told her parents he had a job for Chamu in California, babysitting two American children. But there was no job, and the man who took her from her family wanted her as his woman instead.
In that ranch, I endured domestic violence. He would chase me with a rifle and slap me.
For 15 years, Chamu endured a forced and abusive relationship.
My life has been really sad. I would cry. I couldn't go anywhere. I had no activities. I was barred to the ranch.
Until one day she had enough and left. Once on her own, Chamu knew she wasn't okay and sought out help. But the Latinx community faces language barriers, less access to health care, and cultural influences that keep them from getting help with mental health.
I needed help with my mental health. The mentality we have as Latinos is I'm not crazy, and it's not that we're crazy. It's that we need support of a doctor, a specialist.
One of the biggest barriers is the stigma of being labeled crazy.
You have these people telling you, looking you in the face, and telling you, you can just pray this demon away.
Andrea Vasquez was diagnosed with major depressive disorder when she was 16.
The anger was the bigger part of it, the depression, the panic attacks that I'd been having. And at that moment, I told him, this is a crisis because I don't want to live. Sorry.
Vasquez's depression got so bad she began self-harming and checked into a behavioral health center, something her Latinx parents had a hard time accepting.
I think it didn't want to accept the fact that I wasn't okay. And that's a big thing in the Latin community, that it's to believe that if your child, there's something wrong with your child, it was your fault.
The discomfort over mental health within the Latinx community also has to do with the lack of therapists that can understand the culture and the problems they face.
It's really hard to find a therapist that connects with those issues. Hey, I think I have problems with my family because of my culture. And you're talking to a white male therapist that has no idea what you're talking about.
Hi, how are you doing today?
Good.
Then there are therapists like Lizette Ma, who is Latina and says she can relate to the cultural influences Latinos face when it comes to mental health help.
Grandma believes that if we pray to God and we do, a rosario, and if we go, pay our prayers to the church, God's going to grant us a miracle and the symptoms are going to go away.
Ma says she has to be culturally sensitive to the points of views of her patients and also incorporates them in her practice for successful treatment.
Yes, we can pray, but this needs something more. We have to respect their belief system, but also work with them. So what I tried to do is incorporate those beliefs.
Ma says there is still progress to be made in mental health services and thinks the pandemic made the need more urgent.
Think about what that's going to do to some people in the long run. We're going to see definitely increase of people who are, experiencing some mild symptoms of OCD or maybe some paranoia. There's all these things that we haven't even thought about or actually even seen because we're still in the midst of the pandemic.
As people rebuild their lives from the aftermath of the pandemic, Ma suggests not sleeping on mental health.
It doesn't simply go away. We need to learn and teach people the way to navigate and the way to seek out resources for their specific needs. And how do they do it? And how can they find someone that they connect with?
Chamu is building that bridge to resources for her community as part of Poder Popular, a North County advocacy group.
For me, it's a new life. Since I left my life with domestic violence and got involved with the groups, it's the most marvelous thing I have found in my life. My work for the community and the help I got.
Chamu says these activities have been the best medicine for her to get out of depression and help her community along the way. Tanya Thorne, KPBS News.